So in this video, we are looking at side-lying hip axial rotations. And this movement can be a great way to learn actually how to rotate your hip. For some people, it's quite a difficulty when they go to do their hip car. The idea of rotation itself is quite confusing when we think of it within the full range of motion of the hip, but isolating it like this and just learning how to actually kind of rotate what would be the bone in the socket. This movement, along with say like a laying one, is quite a good one. But the reason why this one might be a little bit more beneficial is because it puts us in a degree of abduction of the hip, and we also have gravity kind of coming down on us, which is making it that little bit more difficult for the hip to move. The idea of changing from what would be having the kind of hip out in front of us, when we think of like what would be the laying hip axial rotation, we have the knee sort of directly on top of the hip. By taking it out, we sort of challenge what would be more of the lateral aspect of the hip, which is really beneficial for us. So in terms of setup in this position, it's quite easy to set up for. You can just get down into a side lying position. You can use your hand as a base of support for the head, or if you want to make it more difficult, say for example, make it more advanced, you could set up the head support like I have here, and I could set my two hands out in front and really get more of a primary focus on irradiation as a result of this, okay? So depending on kind of what the purpose is for you, if this is more of a warm-up movement, something to just kind of get used to at first, you might just do head support. It won't be the end of the world. But if you really want to ramp up, irradiate, and say, for example, this is some max effort work after you've opened up some potential space with Pales rails work, you might want to set up more specifically then with this. You could grab a ball, something to kind of squeeze and have some tension against. But either way, the focus here at first is setting up with sort of the knees out in front of the hip, and you can try to get your knees on top of each other. Now, one of the things that you want to make sure is that your body isn't sort of pulled backwards in any way. And that's going to be really important for when you actually get in the position. We don't want to find our pelvis is actually fallen back and our hips have opened up as a result. So what you're going to do at first is, I like to try to think that I'm trying to push my knee forward first, and then I'm trying to lift the knee up nice and high. And it means I get more tension at the back of the hip. And if you see this from the side here, I'll sort of show from this angle here. When I set up like that, it means my body hasn't actually fallen back. So this would be an ideal setup, and I do my axial rotations from here, whereas back here, yeah, it looks like I've got a bit of extra range, but I've actually sort of moved out of the position and lost the purpose of it as well, okay? But in terms of setup then, we've got those few points. We're going to drive forward with the knee first, lift it up. Now from here, we want to get to a degree of tension in the body to make sure that our pelvis doesn't shift, our core is nice and stiff. What we want to try and do first is internal rotation, and that's essentially going to be driving the foot up towards the ceiling without just dropping the knee into adduction, okay? So try to keep the knee up, internally rotate the hip. Now you're going to go into external rotation. You're going to try and squeeze the back of the bum. You're going to try and drive that foot down towards the floor while keeping the knee in a very similar position as well. So the reason why I say that is because remember, the focus here is on rotating what would be like your thigh bone. That idea of the femur rotating within the socket is what we're going for here. And with this, you're going to find probably a slightly reduced range of motion. You might even find that you cramp on this one rather than cramping on, say, the laying hip axial rotation. But you should be able to drive, hold, squeeze, fight for more range at the end, and then same again, squeeze, hold, fight for more range at each end position. So that's the main points of that movement. As I said, I've gone through where you could possibly go wrong in that position, either sort of falling back, moving the knee about excessively, and not really moving independently with the hip, moving with some other joint by error, for example. But if that made sense, if you liked the video, please give it a like. If you have any comments or any questions or anything like that, be sure to leave it in the comment section. I'd be happy to help. But that one there is a side-lying hip axial rotation.